Now let's talk about the stomach sinew channel. The stomach sinew channel begins as a wider band encompassing the second, third, and fourth toe, traverses the dorsum of the foot, binds at the tibial depression, and divides into two branches. One branch obliquely ascends the anterolateral aspect of the leg and binds at the lateral aspect of the knee. It then ascends the anterolateral aspect of the thigh and binds at the anterior hip region. From there, it sends a branch to GB30 in the direction of the greater trochanter. The sinew channel travels from the anterior hip region across the lateral abdomen and spreads across the lower rib cage posteriorly to the spine. Another branch follows the tibia on the anterior aspect of the lower leg and binds at the level of the patella. From there, a branch runs to the head of the fibula, where it meets the GB sinew channel at GB34. From the patella, the channel ascends along the anterior aspect of the thigh, binds in the inguinal region, passes REN2, and binds at REN3. It then ascends across the abdominal and thoracic region and reaches the supraclavicular fossa to bind at stomach 12. It then continues along the anterolateral aspect of the neck and binds at the angle of the mandible. At the angle of the mandible, the channel divides into three branches. One branch terminates anterior to the ear. A further branch ascends to the zygomatic bone, where it meets the other yang sinew channels at SI18. The third branch circles the mouth, ascends to the upper nose region, there connects with the bladder sinew channel, and then spreads along the lower eyelid. The bladder sinew channel spreads along the upper eyelid so that the two channels together form a network around the eyes. Clinical importance of studying the stomach sinew channel. Pathology. There will be stiffness and aching of the toes, leg cramps, the gastrocnemius and quadriceps muscles, stiffness and pain on the dorsum of the foot at stomach 41, swelling and tension in the inguinal region, Shan disorders, cramping in the abdomen as well as in the supraclavicular fossa and the face, facial paralysis, weakness, and paralysis of the superior rectus muscle. Indication. We mainly use the stomach sinew channel for P syndromes, painful obstruction syndromes, along the stomach channel. The area covered by the stomach sinew channel is larger than that covered by the stomach primary channel. This explains why the indications of points on the stomach primary channel include disorders and diseases of the external genitalia. For example, urinary tract disorders such as cystitis, hernia, and orchitis, which are often treated in combination with liver points, as well as disorders of the eyelids and of all sensory organs. So here is a more simplified illustration of the stomach sinew channel. So it begins on the middle three toes, binds above the genitals, and binds at the hip, connects with the spine, and then binds in front of the ear, while another branch would join with the bladder sinew channel to form a muscular net around the eye. The stomach channel of foot yang ming is exteriorly coupled with the spleen channel of foot tai yin and paired with the large intestine channel of hand yang ming according to six-channel theory. The stomach-spleen relationship is further strengthened by the fact that the stomach primary channel enters the spleen. The stomach divergent channel disperses in the spleen. The stomach luo connecting channel from stomach 40 joins with the spleen channel. In addition, it is clinically valuable to note that the stomach primary channel enters the upper gum, then joins with the governing vessel at DU26, circles the lips and joins with the conception vessel at REN 24, thus connecting with both the upper and lower teeth. The stomach channel ascends in front of the ear and meets with the gallbladder channel, which enters the ear at stomach 7. The stomach-luo connecting channel terminates at the throat, whilst the stomach primary channel descends through the throat region. The stomach divergent channel penetrates the heart, whilst the stomach primary channel ascends to meet the governing vessel at both 224 and 226. The stomach primary channel descends through the breast and nipple. The stomach primary channel descends to cross the chest, epigastrium, and upper and lower abdomen. A branch of the primary channel terminates at the lateral side of the middle toe, the only channel to go to this toe.